Thank you, Madam Speaker. Members, I want to highlight the importance of this bill and where we're at before we go to a vote. Nationally, 33,000 people are dying from opioids every single year. Last year, we had more people die from the opioid epidemic than we did in the Vietnam War. It is now the leading cause of death for people under 55, and 2 consecutive years in a row, our life expectancy has actually gone down for the first time in over 50 years. Members, I don't ever actually come to the well, and I expect you to be quiet and pay attention. We are facing a public health crisis, and these are not just talking points. People are dying every day in our community, and unfortunately, they are oftentimes disregarded. We worked over the interim to come up with a package of bills to identify each gap that we are facing in Colorado, and I can tell you that we would have a much broader reach if we knew we were going to be getting over $1 billion in additional funds this year. And unfortunately, it took pulling teeth to even get the money for our bills set aside. And then we fought for amendments on the floor just to increase treatment by $6 million this year. That's it, $6 million. We are only spending $18 million a year for treatment, and the cost is actually anticipated to be $1 billion every single year in Colorado. So what we did was we looked at a gap that exists in our system to draw down over $100 million federally to ensure that we were actually providing treatment instead of just sending people to the ICU, where we are spending tens of thousands of dollars to keep them alive and then turn them away to the same position that they are in. I have personally seen this. This is a huge gap in our system that exists. People are treated differently with a substance use disorder than they are with somebody who struggles with diabetes, with cancer. None of us in this room would stand even if for this treatment being treated differently for these diseases and for cancer than substance use disorders with the Medicaid coverage. None of us would stand for that here. We would not, even if you don't agree with Medicaid, we would not be okay with treating people differently who are struggling with cancer. This is not about whether or not you like Medicaid, and this is absolutely not Medicaid expansion. Medicaid expansion is covering more people. That is not what this bill is doing. This is including a benefit to ensure that the people who are already covered by Medicaid actually get the help that they need. Now, to the people who don't like Medicaid and have brought that up with this bill, I have said, no problem. Let's take that out and let's dedicate $175 million here at the state level for treatment. Because guess what? That doesn't even come close to meeting the need of what we're facing right now. The only reason we use Medicaid is to draw down federal dollars, which is what Trump has talked about federally in increasing our waivers and has talked about expediting the process. Utah has led the way. This is not a Republican or a Democrat issue. This is a life or death issue. So whether or not you believe that Medicaid should exist or should not, these dollars need to be spent in giving people the help they need, not in the ICU rooms. We passed a bill last year, feasibility study, to look at the cost savings and the costs for our state if we were to include this benefit. And overwhelmingly, we found that in just the healthcare costs alone, we are going to save our state money. Yes, you heard that right. Not only does this bill save people's lives throughout Colorado, it saves our state money because we are actually giving them the treatment and the help that they need. I saw this firsthand when my mom finally said the words after 30 years of struggling with addiction. Actually, at this time, it was 29 years. I want help. I don't want to do this anymore. This was after she was waiting for months for just a 3 days of detox at West Pines. That's all Medicaid covers, just ensuring that you survive detox. That is not actual coverage. There's about a 2% success rate. So we're just burning money. People desperate for help, going in and just getting access to detox. But then they don't actually get the treatment that they need to move through this. Imagine if we started chemo for cancer patients or began the treatment for somebody struggling with any other disease that we have out there or illness. This is completely insufficient. So my mom was waiting for a wait list just to go through for her 3 days of detox, and unfortunately was found overdosing and on her deathbed. And instead of being brought for her treatment, she was brought to Lutheran. She was hooked up to life support for weeks. Tens of thousands of dollars being spent to make sure that my mom lived through that. And that began the first of many overdoses for the next year and a half. In fact, 20. At least 20, because the last day she was brought to the ICU, she overdosed 3 times in one day. So I've seen what this looks like when she was begging for help, and the ER doctor said, "I'm really sorry, but we have nowhere to send you." And we were given a list, and we called through, and there were months of wait lists. So this is the last time that my mom was brought to the ICU. We thought that she was gone. And my mom was given another chance. And it was through the people who I've met working on these issues that told me how to actually get her help. They told me that I had to go through the involuntary commitment process. I actually had to go and get a court order for my mom to have treatment. That is how high the barriers are right now in Colorado. The judge ruled with us, and she was taken away in an ambulance. She was in inpatient treatment for 2 months where she could barely talk to us. She couldn't talk to anybody else, and thank God, because her heroin dealer used to show up when she was hooked up to when she was hooked up to machines in the hospital. And when I showed up at the end of her treatment to pick her up, it was like I was meeting my mom for the first time. I haven't seen her since I was 6 years old. I didn't know how funny she was. I didn't know what a picky eater she was. And she was transferred to Sobriety House, where she was in intensive treatment. Fast forward, my mom is now living at Sobriety House. She's a part-time manager. She received her first paycheck for the first time in 30 years. She has been rebuilding her life, and unfortunately, it took 30 years of hell to get there. So I know what's possible if we actually give people the help that they need. My mom calls me when I go to the doctor's office to see what happened on my visit was. She sat with me while I had to put my cat down this year. We go shopping together. We even got our hair done together. I finally have my mom back, but I am lucky. This is a rare story because most people don't have access to the information that I do. The barriers are significant in Colorado, and especially in rural Colorado. In southern Colorado, our jails, 90% of the people there are heroin addicts. They're going through withdrawal in jail, and they are released into the same situation without help, and they are dying every day. So this is not a talking point. These are people's lives. We are not going to have our doors banged down with lobbyists. Nobody is getting paid to work on these issues. But you will hear the cries in your street. You will see the wait lists in your community. And if you visit the ICUs, you will meet families who are desperate for help with nowhere to go. So this bill isn't about whether or not you like Medicaid. It's acknowledging our budgetary restraints in Colorado and drawing down federal dollars, over 100 million federal dollars in 3 years, only if this is approved, just for the seed of hope for the people that have nowhere to go. Through my time in this work, I have heard from people across Colorado and across the nation, actually, in their stories. And I've heard from people in this chamber about friends that they've lost, loved ones, or even struggles themselves. So just remember that you're not going to hear from lobbyists on this, and we have to do better. That's what this bill is about.
Thank you, Representative Pettersen.